This is the video on the connections for coordination. The main structure in the nervous system for the coordination of muscles for smooth movement is the cerebellum, meaning little brain. This lobe of the brain is tucked up under the occipital lobe and is attached to the rest of the brain through 3 peduncles. It receives input from the brain and spinal cord and sends output to the brain and deep nuclei of the brainstem. Even though it is the main element in coordination of movement, the cerebellum does not send any signals directly to the lower motor neurons. It modulates movement through the cerebral cortex and deep brain nuclei. The cerebellum has 2 basic regions, the hemispheres and the midline structures, the lingula anteriorly, the vermis in the middle, and the flocculonodular lobe posteriorly. There are 2 hemispheres, a small anterior and a large posterior lobe. The anterior cerebellar lobe receives input mainly from the spine, and the posterior receives input from the deep cerebellar nuclei, such as the dentate nucleus. Output from the hemispheres is to the reticular formation, thalamus, red nucleus, and cerebral cortex. Some fibers go from the posterior hemisphere to the fastigial nucleus and then to the vestibular nucleus in the brainstem. So what does the cerebellum do? It maintains out balance by sensing shifts in balance during movement. It coordinates movement by precisely timing the actions of both large and small muscle groups for smoothing out movement. The cerebellum coordinates eye movement, so the eyes move together to maintain focus, even making both eyes move inward to the nose or outward to the temples. It is important for motor learning. When you learn to play a musical instrument, it may be difficult at first to put your fingers where they need to be when they need to be there. After a few practice sessions, your cerebellum does this almost without you having to pay attention. There are diseases and injuries that affect the cerebellum, causing abnormalities in movement. One symptom is total lack of coordination, making it difficult to walk. Another is slurred speech or difficulty speaking. A cerebellar speech pattern is called pressured speech. It is as if the person has to spit out the words to talk. There can also be abnormal eye movements, with eyes appearing to have jerky, uncoordinated movements. Ataxia is a loss of muscle coordination and control. It typically is seen in the extremities first, and then progresses to the speech and swallowing mechanisms. The patient may be seen walking with a wide-based gait, feet wide apart to help maintain balance. Ataxia can affect the heart rate and bladder control. Most of the time, ataxia is progressive and incurable. The cerebellum is vulnerable to toxins including lead, solvents like paint thinners, and alcohol. Often improvement can be seen once the toxin is stopped, but the damage may be irreversible. Because of its attachment with the vestibular nuclei, injury to the cerebellum can cause nausea and dizziness. Exposure to carbon monoxide can produce acute destruction of the cerebellar cortex. This ends the video on the connections for coordination.